Risk factors. Sleep apnea can affect anyone, even children. But certain factors increase your risk. Risk factors for obstructive sleep apnea. Factors that increase the risk of this form of sleep apnea include excess weight. Obesity greatly increases the risk of OSA. Fat deposits around your upper airway can obstruct your breathing. Neck circumference. People with thicker necks might have narrower airways. A narrowed airway. You might have inherited a narrow throat. Tonsils or adenoids also can enlarge and block the airway, particularly in children. Being male. Men are 2 to 3 times more likely to have sleep apnea than are women. However, women increase their risk if they're overweight or if they've gone through menopause. Being older. Sleep apnea occurs significantly more often in older adults. Family history. Having family members with sleep apnea might increase your risk. Use of alcohol, sedatives, or tranquilizers. These substances relax the muscles in your throat, which can worsen obstructive sleep apnea. Smoking. Smokers are 3 times more likely to have obstructive sleep apnea than are people who've never smoked. Smoking can increase the amount of inflammation and fluid retention in the upper airway. Nasal congestion. If you have trouble breathing through your nose, whether from an anatomical problem or allergies, you're more likely to develop obstructive sleep apnea. Medical conditions. Congestive heart failure, high blood pressure, and type 2 diabetes are some of the conditions that may increase the risk of obstructive sleep apnea. Polycystic ovary syndrome, hormonal disorders, prior stroke, and chronic lung diseases such as asthma also can increase risk. Risk factors for central sleep apnea. Risk factors for this form of sleep apnea include being older. Middle-aged and older people have a higher risk of central sleep apnea. Being male. Central sleep apnea is more common in men than it is in women. Heart disorders. Having congestive heart failure increases the risk. Using narcotic pain medicines. Opioid medicines, especially long-acting ones such as methadone, increase the risk of central sleep apnea. Stroke. Having had a stroke increases the risk of central sleep apnea.